The Lagos State Health Management Agency LASHMA has reiterated its commitment to achieving universal health coverage (UHC) through enhanced collaboration with healthcare providers and the full enforcement of its mandatory health insurance policy. This was the focus of the recent LARA Eco Providers Forum held in Lagos, where key players in the health insurance value chain gathered to assess progress and chart the way forward. Speaking at the forum, LASHMA's Permanent Secretary Emmanuel Zamba highlighted the critical role of healthcare providers in the success of the LARA Eco Social Health Insurance Scheme, which now has over 865 accredited facilities across the state. He also announced that more than 400 providers have been trained under the newly launched LARA Eco Academy, a knowledge platform designed to support enrollment and service delivery.
So since the executive order was issued in July of last year, the agency has dug deep to try and put things in place to be able to ensure that when we do start enforcement, things run pretty seamlessly. One of the few things that we have done, which speak to the executive order, is to create what we call an academy. It's called the LARA Eco Academy, to be able to train our providers who normally are service delivery providers. They are not on the demand side. We are now training them to be able to enroll clients that walk into their facilities, because part of the executive order says that when you come into a hospital, you will need to show evidence that you have been enrolled under the social health insurance program before you can access services. So of course that means that the providers are now gatekeepers, as it were, to helping this scheme to move along. Therefore, we are training them, and that is something that we've started. We've already trained about 400 plus and counting. One of the other things that we have done is to set in place a verification process whereby wherever you are, whether it's in the facility or wherever, you are able to check and make sure that this person actually has an LARA Eco Social Health Insurance Policy ID, and that not only that policy is active. So that verification process has also been put in place. We are currently now putting finishing touches to an emergency services program, which we will launch in this quarter of the year, because part of the executive order speaks to the fact that when people walk in for emergency, you should not ask them for their social health insurance plan. You should treat people without asking for money or asking for social health insurance. Another thing that we've put in place is also to ensure that we are expanding the gamut of our provider network. So we've already included the community pharmacies. We are also going to be including diagnostic services as well. So wherever you are in Lagos State, you are able to have access to diagnostic center, dental services, eye care, or even a health facility. That is one of the things that we have also put in place.